Dr. Judd, something I've heard you speak about, which I think would be very valuable for our listeners, is that if you could explain the difference between stress and anxiety, because I feel like
Mhm.
many people believe them to be the same thing, but you have a different take on that.
I think the big difference between the two of them is that stress tends to be precipitated by something. I have a deadline, so I'm stressed about this deadline. I have, a social engagement coming up, and I'm stressed about how that's going to go. And once the event passes, then that the stress no longer has support, so it tends to go away. So you can think of stress being something we're stressed about X, Y, or Z. So it has a clear kind of pathway. Once we get past that, whatever the event is, then it tends to go away. Anxiety is very, very different. It's not that we'd never have stress again. Let me just be clear. We can get stressed about something else, and we can get in the habit of being a stressed out person. We start to get stressed about everything. But that's where it starts to bleed into the territory of anxiety. And so anxiety often has no clear precipitant where, we just start to feel anxious without a clear trigger or without a clear cue. For example, my patients with generalized anxiety disorder, they'll often report waking up in the morning and just feeling anxious as soon as they start to wake up. And so that is, that's probably the biggest difference between the two, because there are a lot of shared qualities as well.
The Everything But Politics podcast.